So we just wrapped up our podcast with Rado at Photon Health. They're building some very cool stuff in the e-prescribing space. When people use apps that are really simple and intuitive, they basically take for granted all the janky stuff that happens the back end to make that happen. So in pharmacy, he talked to us through e-prescribing, through faxing automation, through setting up phone queues for their call center agents. It was pretty fascinating stuff.
Yeah, and their evolution is really extraordinary. I mean, they went from like 0 to 20,000 real quick. So their scale is massive. And we got this view into Rado, who's a co-founder there, leading product, how they thought about both product design and their whole back-end architecture from day zero up until now. We get a demo. So if you're watching on YouTube, you'll literally see what they're building at Photon. And he gave us a bunch of frameworks that they use that really like drives how they make product decisions, which to me were all very different from what I've been indoctrinated in. I think any product ops or early stage person will gain a lot from this one.
Take a listen, try out some of the stuff he suggested, and let us know what you think. So we're here with Michael Rado, who prefers Rado, so we're going to call him that going forward. So Rado is one of the co-founders of a portfolio company of mine. So obviously I get to shill my own wares on this one, which is fun. You know, I've been keeping in touch with the Photon group for a long time, and they've been doing some really cool things on the e-prescribing side, which requires a lot of working with very clunky stuff in the back end to make a pretty seamless process on the front end for patients. So we're going to go a little bit into what Photon does, but I'm very excited to have Rado on the pod. Thanks for coming.
Yeah, thanks for having me. So I'm Rado. Most people call me Rado because the proliferation of Michaels in any office setting. We already hired our second Michael, I should say. So I come from e-commerce background, and then the last 10 years in tech, I spent, my first startup was out of BetaWorks, and then a whole host of different startups, but I spent about 3 years at 30 Madison. So you'll know 30 Madison mostly from Keeps, their kind of flagship brand for a hair loss. And so I started very early, like 30 employees, 10 million in revenue, and then left at 200 million in revenue. Classic high growth startup story. I saw a lot of shit, as they say. I helped launch 5 brands, then moved to the clinical side, did a bunch of deep health integrations where I met my co-founder, the beautiful Otto Sipe. He is not here today. We did the 6-month SureScript integration. We try to build custom clinical tools around prescribing. We try to increase provider to patient ratio and think about efficiency a lot. And the thing we walked away from was prescriptions are awful in America. That is the main thing we're trying to solve now.
So maybe just like set a baseline for the people listening. I know we sort of alluded to what Photon does, but just I'll give the 2-second version, which is doctors are basically able to send a prescription to a patient's wallet. They can then take that prescription and send it to whichever pharmacy they want. So even if one pharmacy is out of stock of something, instead of needing to go to the doctor, have them re-prescribe it or whatever, the patient can just send the script wherever they need. I'm curious, can you just tell us a little bit about like what is actually happening in the background to enable something like this?
I mean, the high level is basically we sell prescribed tools to doctors to meet the need of folks that are building custom clinical tools, right? Most traditional EHRs aren't meant for high volume growth stage startup type of patient to provider ratios where you just have one provider treating 1,000 patients in a day, whether it's a message or not. That's our business model. The patient experience came out of the fact that ultimately, providers are making a lot of administrative decisions, right? They're deciding what pharmacy to go to. And our general take is a doctor should never be proxying a decision for a patient. So in our world, you get a text message, doctor wrote you a prescription, you can open up a pharmacy selection flow, you can give us your expected ready time, you can search by hours, all things that are really painful if you make a bad decision when you go into a hospital or your brick and mortar clinic and choose a pharmacy up front, and then it's the wrong pharmacy, right? And then it's stuck at that pharmacy. You got to call the doctor back, yada, yada, yada. And so what's happening underneath the hood is that we've effectively separated a prescription order into 2 separate constructs. So in everywhere else in the United States, there's a standard that says, not a regulatory standard, just a standard that was invented that says a pharmacy has to be a part of the prescription. We've said that's a fulfillment choice. That's not the doctor's choice. And there's a whole lot of conspiracy theories and things I can go into about why this is. But at the end of the day, it's just a bad consumer experience. And so what we said is we'll separate the prescription pathway. That's for doctors. It's immutable. It's the treatment pathway based on the diagnosis code and the condition that the patient has. And then the fulfillment decision can be triggered by anyone, whether it's a medical operations person that wants to do a check-in before they pick a pharmacy, whether it's the patient themselves, or whether you want to do it programmatically via an API so that you can fulfill your specific finasteride at your vertically integrated pharmacy, to the Keeps reference earlier. So underneath the hood, what we're doing is we are sending a prescription to a pharmacy via fax most of the time. About 55% are e-prescriptions. And this was our big bet, that as we gain traction, as we redefine consumer expectations, that we would get more and more pharmacy integration. So that's been proven with massive retail chains all the way down to your sort of like regional mail order pharmacies. What we said is that fax is not a prescription, it's a notification. And the pharmacist can log into a pharmacy application using the same security credentials that you need to pick up a prescription. Fun fact, in the United States, all you need is the pharmacy, the name, and the date of birth of the patient, and you can pick up even a controlled substance, which is a famous lawsuit in California that went down. That is the level of security we're dealing with generally. And so we mimic that. If a pharmacist has that digital prescription, digital eFax, I should say, they can log in, verify the patient's information, data enter it, and fill it. In the meantime, we have to make a phone call. And so we make a phone call and we say, hey, did you get this prescription? When's it going to be ready? Do you have it in stock? Is the patient's insurance on file? All of the things we're doing normally happen by A, the patient getting to the pharmacy, or B, calling the pharmacy ahead of time, which is massively painful, especially for folks that have multiple chronic conditions and or multiple prescriptions, or folks that have kids that are sick.
And just to clarify for my understanding, so if you are not integrated with the pharmacy, then the way that you guys send the prescription right now is through fax or phone call. And then when you are integrated with the pharmacy, you send a direct e-prescription.
That's right. The clarification I would make is the prescription, the fax is, our general take on this is the fax is a notification for that prescription. It says, hey, here's the data. You can access the digital prescription here. And that meets the broader requirements around digital prescriptions in the United States. Either way, we make a phone call, right? Because we need to get to the consumer level that we've outlined, which is basically saying, hey, we're gonna build this like we would Uber, DoorDash, Instacart, Airbnb, fake it till you make it. And we're gonna build the consumer experience that should exist. And then we're gonna work backwards on the tech. Famous Steve Jobs quote. Sorry, I have to quote Steve Jobs. It was the only time I would do it, actually, to be honest.
I wish you were wearing a black turtleneck. It would really elevate the delivery.
But you see, most folks in healthcare, I will say, that I see are trying to shim in or live on top of the already existing infrastructure. Yeah, I think it's a disaster.
The following message is brought to you by Out of Pocket. People who have been tasked with building a call center have many questions. How did I get this job? What are my options? How will this affect my loved ones? Will I ever be happy again? You need answers. That's why we made a course led by call center veterans who've been there and recovered. Join nearly 100 others who have not learned the hard way. To enroll, call toll-free today to reach no one, or go to outofpocket.health. Hear from Stephen, a student who said, quote, "This course was hugely validating and packed in many invaluable insights that we would have otherwise had to learn the hard way. 5 out of 5 stars. You can be Stephen. Save money. Start learning. Enroll today. For $100 off your seat. Use code ANSWERS. That's code ANSWERS for $100 off."
This episode of Ops, I Did It Again is brought to you by me, because no one believes in me more than me. I'm teaching a Healthcare 101 crash course that starts soon. You can find it on the Out of Pocket website at outofpocket.health. We go over all the major stakeholders in healthcare, payers, providers, pharmacy, all those in-between acronyms that you've been too scared to ask people what they mean. We talk about how the money flows, major laws in the industry. It's the fastest way to get up to speed on US healthcare. You can use the code IBelieveInMe to get $100 off.
Walk us through the life cycle of a prescription. But really what I want to know is very detailed, right? So like within 30 minutes, we have to call the pharmacy. And then what happens from there? Or they get a text if they don't answer within 3 minutes. Like, I want to know your whole crazy formula behind the scenes.
Yep. Okay. So doctor writes one or more prescriptions, sends that order to the patient. Patient can select a pharmacy. They can pick an urgency time, which is something we're testing now. And then, so basically, what time does the patient want to pick it up? And then they go into the pizza tracker for prescriptions, right? So just imagine DoorDash or any other sort of modern consumer marketplace or tech-enabled service business, right? And so basically, a patient will get a text, go through the pharmacy flow, pick a pharmacy, give us an urgency time, and then get a series of text message updates. In the same time, basically within 10 minutes of that order being created, we call the pharmacy. So it enters into a queue, and it is a timer starts, and we measure this based on order aging. And we have an SLA that's effectively 80% of prescriptions are confirmed, meaning we check that the pharmacy has inventory, we get a ready time from the pharmacist, a promise time effectively, and we check if there's any insurance gaps at the pharmacy. 80% are in under an hour, 60 to 70 are under 30 minutes. And I would suspect 40% are under 15 minutes. And so our SLAs are wild. And so part of what we did with the urgency collection from the patient is say, when do you actually want to pick this up? Because right now it's first in, first out. We treat every order as the same. And when orders start to age, that's when things are going very wrong. And that's generally bad for us and our customers and the patient, right? We try to limit that as well. We have a team of external agents and internal agents handling escalations, and then folks that are just hammering the queue, getting through it as quickly as possible. About 50% of orders are one touch. This is a critical metric for us, right? Because every time we touch it, that's the same average handling time, the same average downtime that it takes for a real order that's going to be a happy path order. And so then you have an agent spending that time on an order that's not going to be confirmed. So there's lots of conditions that go into why that might be. The big one is out of stock and an inventory issue, but most of the time medications can be ordered. We deal with a lot of pediatrics customers, and we love them and they care about us the most because we help most with the most painful issues in terms of like parent has 2 sick kids. We see things like parent has 3 sick kids. They all have the same condition. Mom needs medication at 2 a.m. and is driving around Austin trying to find a pharmacy that's open. Oof. So we just cut through all of that, right? We will call nearby pharmacies. If a medication is out of stock, we'll find it in stock. We'll offer that to the patient and they can confirm it. There's a whole ton of things we can do to automate and streamline those workflows internally, which we're doing. But at the end of the day, it's when we joke internally, right? It's when the pharmacy experience is awful that the Photon experience is great. And the responses we get from patients are pretty wild because of that. Things that they don't expect from a normal pharmacy experience. And from that point on, if an escalation happens, something goes wrong, an internal agent can't handle it, or I should say an external agent can't handle it, it goes to an internal agent. So these are, pharmacist has a clinical question about the prescription and we need to get in touch with the doctor. What we do is basically triage all the pharmacy orders and say, is this a real issue that can't be handled by anybody but a doctor? Then we forward that and triage that to the clinical folks for our customers. If it's not, we try to handle it. So that's out of stock. That's a question about the patient's name, yada, yada, yada.
I think maybe just to like switch gears a little bit, because one of the things that I think was interesting when we're prepping and talking about this a little bit is just to show people kind of the scale of what we're talking about, was when one of your customers had an outage with their e-prescribing and you had to make thousands, I think tens of thousands maybe of calls. Can you just like tell us a little bit about that story and what ended up happening and how you got out of that?
Yeah. For historical context, when we first started this, we were working in Slack with Slack integrations that would pipe orders into Slack and then would open them into a really not a queue as much as Slack was the queue effectively, but just an order view in Retool. And then we were everybody on the team, very much like Paul Graham, do things that don't scale. Every single person on the team, whether it's an engineer, designer, founder, was taking calls and understanding what was going on at the pharmacy. And so we were in this transitional phase where we knew with the upcoming scale that we had to transition away from this and build a true kind of queue and optimize for scale. And so right after that got done and we were testing it, one of our customers, who was a pediatrics-based company, had an outage with their prescription provider. And the benefit of being in healthcare is it's all IT companies. No one's outside of digital health and outside of like true innovative startups. Everybody else is like an IT company. No one's product oriented. No one's tech oriented. And they're not great in terms of service level. So we felt this at 30 Madison, right? We had outages all the time. We would not be able to send prescriptions for a day. That would be like 50,000 orders we had to delay. It was insane. This customer had an outage. They asked us to accelerate our rollout plan that we had started. And I was about to go upstate to the Catskills for my one vacation this year. And I bounced. And we made a founder level decision that we were going to move forward and it would be okay. And our volume projections and capacity planning were, let's say, real bad. So in the valley of Hunter Mountain, where just get a sliver of internet service would come through or cell service would come through, would just get 18 Slack messages. And so I saw this happening from afar. And the first week was rough, but we learned more than we had learned thus far. I think as product people and engineers and ops folks, I think we all try to theorize and plan and try to de-risk as much as possible. But there's nothing like learning from doing when you increase your volume by 5x. And so we felt that pain, and we learned more in that 1 week than we had learned in probably 2 months. And that's partially why we're here today.
That's awesome. From there, today, now you guys have obviously handled a much larger volume of everything, right? Can you give us like a sense in the last month, like how many phone calls, how many faxes, like what are some of how many messages are you sending? What are some of the stats around like the volume you guys are doing now, up from obviously that one? Slack obviously is not meant for the volume you're doing today.
Yeah, I felt Slack was breaking down, which was a sight to see, like literally from a technology standpoint, the product was crashing. And so I think we really tested the boundaries. But right now we're doing 20,000 orders a month, about 15,000 faxes, 10,000 legacy ERX, and about 26,000 phone calls. For that 20,000 orders, we get about 3,500 text messages. That's inbound, and outbound is roughly the same. About 30% of those are thank yous. So I don't know when the last time is that you responded to a very clearly automated message, but our patients do a lot, which is awesome. So the challenge is now, once again, classic growing startup, is we'll 5x that in the next 2 months. And so making 100,000 phone calls, 200,000 phone calls, that changes things for sure.
One thing I found myself doing by accident is sometimes I'll do the like Apple like thumbs up reaction to an automated message that comes in, but it's an SMS, right? So I'm like, oh no, did I just like send an SMS back with a thumbs up thing?
We get those. We get liked. Yeah. Liked in their own message quoted to us. And we're like, okay, cool.
One of the things we had asked you a little bit again beforehand is, what are some of the first things you automated when you began this whole process? It sounds like you had some pretty janky beginnings of probably Slack bots or Zapier piping into Slack and all this kind of stuff. But can you tell us like what the first thing you were like, okay, we need to definitely automate this?
Yeah, I mean, so now that this is core to our strategy in general, I've broken this up into 2 buckets, right? So we think about it in terms of automation, which is just wholesale replacing human workflows, and then optimization, which is making humans faster. For automation, we technically really haven't done anything in terms of true replacement of workflows. We're exploring a ton, and that looks like trying to get an AI bot wait on hold and then transfer to a human. In terms of like optimization, the first thing we did was get out of Slack. And so we built a queue that we now call the push queue. There's a big distinction here. This was a paradigm I've seen at every telehealth company in terms of product folks that I've talked to and how they handle their clinical workflows, is that you have a queue where orders can be claimed. That would be a pull. So I'm an agent and I have to make the decision, what's the next order? And then the other side of that is you just push an order to someone and then they take it. And so we just released that, and I can talk to the results there. But the big thing for us is we have these KPIs that we look to, and we have handle time, which is difficult, right? Handle time is basically how long it takes to work an order. What's an agent doing? Are they answering a text message? Are they reviewing the context of that order? Are they making a phone call? Are they waiting on hold? Because that is an uncontrollable variable for us. And then the other piece is downtime. And so downtime is like what's happening. An agent is not claiming an order. And so we have we've first pushed out the push queue and the pull queue effectively. And we saw a pretty, massive increase in our capacity, but we saw a lot of downtime, and we don't know what's happening, right? We're not sitting with agents. We don't understand what they're doing necessarily. And so now we've started to say the real thing to automate here is claiming an order. So that's arguably automation, right? We basically said, you are no longer the human making a decision. We're going to do this for you, and we're going to do it programmatically or algorithmically, and that will help to reduce downtime. So we just released that. Downtime in our peak time went from 4.5 minutes to 1.5 minutes in a week.
Wow. It's interesting, your definitions of handle time and downtime actually really speak to how producty you are, because in the call center world, handle time and downtime would just be for a single interaction.
Right.
It wouldn't be for a cumulative order, but actually that makes a lot of sense that you consider handle time as a full order, and makes your life a lot easier as you're trying to figure out where there's room for optimization and automation to your framework. I'm going to add that to my next slide on the course.
Give me real definitions. Yeah. We're just parroting it over here, right? We read like one blog post. But the way I think about it, the way I calculate it actually is like the end-to-end completion time is downtime and handle time. And that's
true.
How many times can you do that per hour? And then we look at touches per order, and we say, okay, now each order has to get touched twice to be completed. And on average, overall, downtime plus handle time takes 20 minutes. That means you can really only touch 3 orders, and half of those aren't going to get completed. So you start to compound these things and you look at it and you're like, well, what's happening? And so it does become glaringly obvious about where the opportunities are. And the product side for me is like, what do I think is actually in my control? What can I really do? And so a lot of it's incremental, but some of it is big swings. And so that's the difference between saying, okay, I can optimize how long it takes an agent to send a message template, but I can wholesale replace them picking an order and might shave off 3 minutes per order completion time overall.
What happened internally where you decided now is the time for us to move from this pull system into an automated system?
Part of it is what I was just talking about in terms of 20,000 orders to 100,000 orders.
Scale.
It changes the problems at hand from a unit economic standpoint to the business problems to also our ability to just maintain quality.
So let's stay on the queues then. So you decided now you're automating it. Has that impacted your system design? So are you like able to use the same infrastructure you built, or do you have to toss that, start over? What's happening there?
The original order queue was this, and this is all demos. This is fake data, no PHI. And this is our demo. So it's a bunch of old orders. And we basically have wait time, which is when was the order created. We have last action time, which is somewhat anecdotal. And this is part of the issue with agents having agency around what to claim is, right, like you're doing this mental math of what's most important. At the end of the day, it's probably more simple than that. What's the oldest and what's most likely to be picked up? And so you see...
Why is everything red? There's just a lot of red here.
Because I'm trying to get to the non-red. Yeah. Everything's red. Everything
Make
red
it look better.
This is like demo, right? And so everything sits here forever. No one actually manages the order. So this is what the end of Photon would look like. And so you have this queue. Interesting fun fact: when we first rolled this out, we noticed a trend. When things got really bad, we noticed a trend that a significant number of orders aged for a long time. And then our time to first touch increased a lot when we were backed up. And we also knew that about half of orders are happy path, right? They're call once complete. We ran a new process that basically said one group of agents is going to pick up the newest orders, which you're looking at now. And one group of agents is going to pick up the oldest orders. And they just met in the middle. This had a drastic improvement on our performance overall, because what you see is all the happy path orders just get mopped up quickly. And so we had them only wait on hold for 5 minutes, call the pharmacy, see if you can get through, hang up, try next one. And our performance metrics improved statistically significantly, drastically. So in the order of 20%, I think, improvement in average time to received, or what we call order aging is average time to receive. So massive improvement overall. And that's just pure ops. So now we just released what I'll get to, the push queue, and we started to mimic that logic, and we're proving that as well.
Quick question, Rado, on this. Yep. When you say claiming, you're claiming it for a one touch, or you're claiming it for its entirety of completion?
Yeah, so it just re-enters, right? I think call centers call this re-entry rate, right? And so
this is straight up a queue. Got it.
Yeah, so this is straight up a queue. It's based on wait time and last action. We were saying, okay, it's first in, first out. But that left a bunch of new orders sitting around. So they aged more and more, and it brought down our overall metrics, knowing that half of them were going to be easy, right? And so in a normal workflow, you have an order, you can see the customer, you can open up that order item.
You basically created the middle out compression algorithm thing from Silicon Valley. Like
exactly.
You did the reverse of that.
Exactly. The irony is I heard that Amazon does the same thing for their queue internally. We have some folks that came from Amazon. So I was like, oh, cool. They have like actual logicians and mathematicians working for them, but we just rolled the dice on
You just vibed into the answer.
Exactly. And so here you have, we redid this. I wish I could show you what it looked like before. It was scary. Classic. I came from this in many orgs, right? Your admin tool is just like a Frankenstein, buttons thrown everywhere. Anytime there's a feature request, you just throw another button in. It looks like a bag of Skittles. We took a step back and said, if we want this thing to be extensible, we're going to redesign it based on the happy path, right? So for the happy path, you have the name, date of birth, you have the pharmacy, whether it's open, and the wait time, and you can call it quickly. This is actually G voice, but now we've automated the outbound dial. So the first call is made by us. And then you have a queue timeline, so you can see the history. This is where you see maybe this order's been touched 3-4 times. And then you also have escalation. So in order to do anything, you have to claim it, right? This is like our record, our control mechanism to understand what's happening.
Oh, smart.
Yeah. So we can see the time it was claimed, how long it took to claim. And then if anything happens, you can see a bunch of issues where you might want to escalate the order. And then there's queue level actions. So these aren't relative to the order, they're relative to the actual queue item. So if I want to mark this queue item as no action required, in those cases, the patient might have said, actually, I don't want this medication. We'll just mark it no action required. Sometimes there are sibling orders. One of the hardest problems we have is just duplicate messages from doctors that write multiple orders. So I could wax poetic about that for days in trying to limit what in today's world has no consequences, right? We've heard from providers that, especially pediatrics providers, that they'll just throw out 3 prescriptions to nearby pharmacies just in case one of them doesn't have it in stock. And they'll just tell the patient. So that just the behavior from the systems level of folks working within it and just learning to work around it is really hard to undo. And then we also have a couple steps where we might be waiting on a question from the provider to be answered, or we're waiting on the patient to confirm something like, do you want it at this pharmacy, a pharmacy change? And then you have all the core information. So it's very much happy path optimized. This did not change. You can see the instructions for that sort of process I was alluding to in terms of folks mopping up new orders versus old orders, is we also wanted to prevent order aging. So if an order is above 2 hours, just wait on hold, get through, and make sure that the patient gets an answer. So this changes programmatically based on what the wait time of the order is. So that mimics that manual behavior.
You've basically created a call center mashed with a CRM. And what you have, you showed us 2 views. The first was the queue, which traditionally would just be like a call center queue of here's everything on deck with an aging. But what you've done distinctively is created a claiming sort of function, which neither one of those kind of intrinsically have.
Right.
And the claiming function unlocks any action that you can take on that, which would prevent any user from being able to just jump in, and creates traceability on every order because you have like agent level information. And you can treat that as a time point. So super nifty, that claiming function.
Yep.
Right. And then on the patient level, which is like where you're showing us now, it's not really any different than a CRM or an EHR that shows at a high level information about the patient. Then you have escalation, which I know routes to your ticketing system. So you just built like a small button that then you can escalate any sort of issue into a ticket. And queue timelines are exactly what you would find somewhere else, but you have very cool, like almost like intelligent queue decision-making skills for an agent to help them know what to do with that queue information. And you have actions on a queue, which is effectively a call disposition that you would have inside of a call
100%.
center. So you've kind of naturally recreated a lot of things that you would get elsewhere, but it really makes a lot of sense in this context. I wonder if you look back on it now that you know more, do you think this was the right call to build this all from the ground up?
Yeah, I mean, so we also use Zendesk and we used Intercom. We've thought about many sort of CRMs historically, but the challenge is what we found is none of them are actually built to manage outbound. Salesforce would be the closest thing, but if you talk to sales folks, most of it's about making a call. Very few are connecting. We need every single call to connect. And so what we said is the combination of retool from an improvement in development time or engineering time, product development time, I should say, we kind of offset the build or buy decision by saying, well, we'll use retool. We're going to build a custom R system. And I'll tell you what hasn't really changed is the sort of number of exceptions. Like it's all the same. We've hit the max quota of what can happen at a pharmacy. So we know everything is somewhat predictable. I don't think, generally speaking, the number of escalations will grow significantly. And more so, we've handled the outbound dialer automation where we need a call to connect, we need someone to navigate an IVR, and we need an answer and data collection, and we have a 15-minute SLA effectively that we're trying to shoot for. So that combination of things didn't really seem that there was a tool that can handle that. Hit me up if you know one, anybody. But
I think the thing, maybe if I'll get like a little bit on my call center spiel here, is that people try to think a CRM is what solves the outbound challenge, but actually a better call center software will solve the outbound challenge because they are designed almost like it's analogous to designing a sales team. You're not designing a customer support team, you're designing a sales team, and a sales needs are repetitive calls, dispositions, and dispositions that trigger other types of calls. Once we transitioned to something more like analogous to that in my last company, it made life a lot easier on the outbound campaign side of things. So those are called campaigns in the call center world, each one of these things.
Right. So when we think about the sequencing between where we're at right now with humans and where we want to be with pharmacy integrations, and then eventually AI, is how do you make a bunch of calls at once and then route it to a dialer, or route it to what is effectively, workforce management tool or CRM like Dialpad. And there isn't really a lot of intelligence that you can do around passing data through that and making sure all the data comes in correctly, around what order you prioritize, what order that the agent is supposed to be working on. And so nothing really met our needs completely. And now we're at a point where, and this is somewhat why we built this push queue, is that we built the push queue to, we built the push queue to basically say, okay, in a world where we replace dialing and the actual connection to a human, we need to handle the whole routing layer. And we need to say, what is the most important order to work? And we need to push it to an agent. We need to make that call. And then eventually we're going to replace that piece with AI to wait on hold and navigate an IVR, which is baffling that no one has seemingly solved that problem. It's very inconsistent. And so in this world, if I complete an order and say this is going to be ready in 30 minutes, we can update that order and I'm immediately pushed another order. So this is the test I was referring to, where our downtime in our peak hours went from 4.5 minutes to 1.5 minute in a week time scale. And so you remove this cognitive load of saying, what's the most important order next to take? And I just get piped another order. And so it's hard for me to see a world where we were doing this with off the shelf technology, knowing that our true path is to just wholesale replace most of the human workflows for the happy path, right? It's basic data collection at the end of the day.
I wanted to just maybe end this by talking a little bit about what automation has looked like for you today. We're sort of talking about what generative AI kind of means for companies like yours, right? Like, have you tested out things like, hey, can we do actually even like robo outbound calling or any of these other like more sophisticated generative AI kind of use cases for something like talking on the phone or even interacting with the real world in some capacity?
Yeah, for us, as I mentioned, I think it's a race towards both integrations and AI replacing a lot of the core workflows to really get us the consumer experience that we're trying to give. As in, here's the expectation when this is going to be ready. It's out of stock. What are the exceptions? There's a lot we can automate across the board. And so we're going to do both. We've evaluated probably 20 different vendors, 10 to 20 different vendors, and all of them, one, if you don't have API docs on your site, red flag. We only have found one that seems viable. But what's actually shifted is a general belief in viability. So we hear from investors now that yes, in enough of a time scale, this will work. And we believe that. So that's mostly what we care about, because it means what we need is time, as any sort of seed to A stage startup. And we need support and belief that we can do this over time. And we need integrations. So we'll get that for sure. And so now it's kind of shifted the conversation to not if, but when. And the tests that we've run so far definitely have some room to grow. So we ran a bunch of tests to pharmacies, and you have whatever sort of middleware transformer that actually accidentally is converting the text to Mandarin. So that's not going to work. You have a lot of drop rates in terms of just that basic problem I mentioned around, can you get AI to wait on hold and tell me when a human is actually talking versus when you have a repeated voice saying, CBS, if you'd like to check out your order online, go here. And so that problem is really hard. And we haven't seen a ton of success in terms of hit rate. I can't give you a number, but it's in previewing it, it's enough that it's like, well, this probably isn't going to work at scale yet, but it does work sometimes. Our benefit is poor pharmacists have such tolerance for like inefficiencies on a phone call that they'll just wait. I've done a couple tests myself with Bland AI, which is one of these companies, and done specifically the workflow of transferring to a human, which is a huge increase for us. It means probably 40% of the calls waiting on hold and then transferring to a human. It means no one sits on hold. You're just constantly queuing up orders that are ready to go. I had 3 separate pharmacists wait to get to my voicemail before hanging up, meaning they talked to a bot, they waited for a phone to ring, they waited for a voicemail to say, hey, this is Michael Rado, and then they hung up when the message connected. The tolerance is pretty high, but we also want to be careful, right? We're trying to not destroy the trust of pharmacists. They're one of our 3 core users, and so we will phase it accordingly. And like I said, the first thing we'll try to do is get a bot to wait on hold, and then we'll try to do the happy path, right? The happy path for us is basic structured data in return. It's, did you get this? When will it be ready? Is the patient's insurance on file? And so that's collecting 3 data points and then piping it into a separate workflow if there's an exception. So we have pretty high confidence that in the next 6 months, we'll get to a working prototype that is viable, maybe sooner, but we'll see.
So you talked about timeline of this project being 6 months. That got me curious a bit more on how you're approaching product more generally. Can you share a little bit about how you prioritize which products, what product builds to work on? Excuse me, is some frameworks, I don't know, programming this, like what's the deal?
I am ruthlessly idealistic about product and how it works with other functions. So I would say I like to start with the definition of product, which is basically something that creates value for a business and a consumer. When those things get out of tow, right, when they become imbalanced, you have shitty businesses or you have great unviable businesses. And so we're constantly trying to toe that line of how do we create a ton of value for our consumers and our customers and their consumers, and then how do we create value for ourselves. And so much of this is hypothesis driven. We look at data. Melissa Perry's great on this, the product kata, right? We start with what is the state of the world today? And we look at our efficiency metrics. We look at our conversion rates. We look at our customer growth, and we say, what is our biggest problem? And then we take a couple bets. And so we're a team of 15, mostly engineers, but not all builders. And we say, okay, this next 2 quarters, automation and optimization are the most important strategies we have. We want to create a better experience around optimization. And I haven't really said this yet, but part of this is being able to provide greater granularity for our customers. What happened to this? Think FedEx. Your order was delayed because the address on file is incorrect. So how can we really create this end-to-end consumer experience where you have transparency in every step that happens? And so that's value for both of us. And then automation is reducing our overall cost, but it's also saying, hey, we want to mop these orders up as quickly as possible. Patients have urgency. They need to know what's going on. They don't get this from anywhere else. They're generally waiting on hold for an hour to get this elsewhere. And so we need to do this as quickly as possible. And so that's the core strategy. Then we define 2 North Star metrics that are lagging, and then we leave it up to the squads. So we have 2 squads, one mapped to each North Star. They get a key metric that's a lagging metric. We work together to map out proxy metrics. So for optimization, right, it might be the time it takes, it might be handling time, average handling time overall. How can you reduce this? If a PA is required, instead of picking a message template, can we click one button that picks a message template and then updates the provider on their side and updates the patient? And you just shaved off a minute of our handling time. Great. And so very much outcomes focused. Our roadmaps reflect that. It's now, next, later. We are hypothesis driven. So I try to get folks to get to an estimation question. How many hours do you think you can save for 50,000 orders? If we take, so that example of the push queue, if downtime is 4 minutes, now it's 2 minutes. We just cut downtime in half. What percentage of the total working time for an order is that? Did we reduce the amount of time it takes to complete an order end to end by 20%? Is that the most viable hypothesis you have? Then run with it. The reality is, if you get into a world where you've got 15 variables that are inputted into a spreadsheet and you're trying to rank order based on impact, effort, and potential revenue, you're basically in a world where you don't understand what the biggest problems are for your business. Take a step back and look at the data and understand where the biggest opportunities are. And you probably have a top-down architecture or an organization that's pushing you to do things, and you're trying to meet some goal that you don't even understand. Here's the biggest problem. We understand that automation will get us to the next phase of growth. Now it's up to the team. And so that's where we see empowered folks taking shots.
It's up to the squads, actually.
Exactly. And so you have 10 bets in mind. You have probably going to take 5. It doesn't matter if 1 or 2 or 3 is more important than the other. You're going to get 5 done. So just take the ones you have the most confidence in.
That's awesome.
My astronomy is rusty, but 2 North Stars feels like something that doesn't really exist.
What is the big difference?
Fair. I mean, for us, the North Star is a single metric for sure.
You're such a troll, dude.
A troll. Come on.
I'm just messing.
One quick thought on that is there's like this saying in design thinking that if you told somebody, can you design a better spoon? They'll design like 3 permutations of a spoon. But if you told them, can you design a new way to eat soup? They might not even come up with a spoon. And so in your example, that's really what stood out to me. You're like, how do I reduce handling time? And so I think that's what empowers people, because they're like, oh, it could be a spoon, or it could be this, or it could be that. And suddenly you create like really creative ideas. So I'm really excited to see what your squads are going to think up. I hope you tell us.
Yeah, it's fun for sure. And I think, honestly, it leads to folks that are generally more driven and happy and feel the weight of their decisions. Like the worst thing you can do is just build features and ship them and have no idea what worked. Then your measurement becomes how many features did you ship, which is classic. How many story points do you got under your belt today?
The third North Star, obviously. Just
I'm
kidding.
done. We got to wrap this up. You're getting unhinged.
All right. So to wrap it up, at the end of each podcast episode, we ask our guests to basically give 3 actionable experiments that people can try in their own orgs that you've seen work or things you've tested out. So are there some things that for listeners that you could leave them with, takeaways?
Yeah. So when I look back on how this thing worked and how we got this far, the true test, to your point, is in 5 years where we're at. So I think about early on when we had a bunch of hypotheses, we had a bunch of signals, but we didn't really have a ton of users to roll out a feature and look at the usage or look at engagement. We had this early idea to let patients pick their pharmacies, and our bet was like doctors would be jazzed about this. And so that's how the patient experience came about. We shipped a prototype, we built it super scrappy, didn't connect to any of the system, and it looked pretty real. And we went out and sold it, and we landed our first 5 customers. The misconception is it's not the genius in the group coming up with the next best idea. It's a bunch of ideas and then going out there and saying, hey, would you actually pay for this? So that's stolen straight from Steve Blank.
Nikhil, is that when you invested, when it was like connected to nothing and you're like, that works and that's cool?
Nikhil was earlier than this.
Mine was even worse. It was Otto barely had a deck together. It was just like a thought.
Piece of paper.
Fuck it, I'm in.
Yeah, it was just a piece of paper and like a great gold chain. So the next one is like do it with a spreadsheet. The number of companies that we talked to and the number of organizations that I've been a part of where someone likely has an MBA, is pitching some idea, enforcing that the real thing has to be built and you can't sacrifice anything is absolutely ridiculous. Amazon, when it started its small business program, you literally had to type in your SKUs, description, product names into a spreadsheet, and they would scrape it once a week. And that's how they started that business. So if Amazon can do scrappy experimental testing to validate an idea, anybody can do it. De-risk it before you invest 6 months of time and a lot of smart engineers' time. And then the last one, I was going to give you like another product thing, but I actually think like do weird shit with your team. So the first onsite we flew in the whole team, and we had one of Otto's friend, Taylor Myers, Tay, who now runs a little bar called Number 9, come in and do basically a workshop. And the first exercise we did, literally no one had ever met anybody from the extended team yet. We sat cross-legged across from each other, stared into each other's eyes, put our palms on our forearms, and tried to squeeze as hard as we could while Tay read a general kind of like poem to us. Sounds a little hippy dippy, but I talk about that with the team, and the team brings it up nearly every time we have an onsite and says, can we do something like that again? The feeling of like closeness, getting weird, and my favorite investor is Long Journey, and they get real weird on their onsites and offsites too. Like make people uncomfortable and get people out of their skin. It's a professional environment. You got to have some boundaries, but like try to do things that shake people up and force people to like open up a little bit. So that's a big ups to Taylor and also Otto.
I will say that like when I was in college, I was on a dance team, and our best choreography ideas would always come when we're in the weirdest environments by far, because people are so uninhibited at that point that obviously alcohol helped a little bit, but people are so uninhibited at that point that they'll just pitch the ideas that are like half jokes. But every good idea always starts as like this strange half joke where you're like, haha, but what if? And then, but to create that environment is very difficult. And so you need a little bit of weirdness to kind of break that ice and like, make it comfortable for everyone to like pitch what they think might be a weird orthogonal solution to a problem. So that resonates for sure.
Yeah. I think the challenging part and what we've done by hiring people we know is like, how do you get people to trust each other, make decisions, take bets on each other, and get past that initial social intelligence that's required to really collaborate at a heightened scale. And getting weird helps, and alcohol helps. By the way, that was no alcohol involved. So
Damn, just using our brains.
Yeah.
I respect it.
Yeah.
All right, Rado, I know we're at time. We appreciate you coming, sharing some of your learnings along the way. Very excited to see what the next 100,000 scripts look like and what breaks and what you end up fixing there. But we hope people learned a lot from this one. I did, for sure.
I did too. Awesome. This was awesome.
Great. This was great. Appreciate you both.